Yeah, folks, you can hurt yourself playing that music right there. Well, you can hurt yourself playing any music. You can hurt yourself tuning. And if you don't believe me, just ask Janice Ying, physical therapist to the music world, from flautists to cellists to drummers to anybody that uses any limbs or appendages to play an instrument. That's who she caters to. This is Drumming Injury Talk, an original Drum Talk TV series. And today we're covering the neck, right, Janice? I'll try not to be the cause of the pain in the neck today.
You're the pain in my neck, always.
I hear that so much. It's like proliferating through all the women I know, from daughters to wife to co-host, staff. So yeah, neck pain. Let's start with neck pain for drummers. Yeah, and we'll talk about other things with other, violinists do this, and maybe bassists, guitarists have their rigs strapped in a certain way where it affects their posture or the weight that's not right for their body type. But sometimes we go for looks, so we'll get into that. But with drummers, what's the most common cause of neck pain, other than listening to made up stories by the lead singer? What's the most common cause of neck pain amongst drummers? Is it as simple as posture? And folks, we're not talking about drumming injuries from lugging your gear. We're talking about from playing.
There's also a very real thing too, though.
It is. That's true.
It's a very real thing. I see a fair number of people who get hurt from just carrying gear or even sitting in a car while they're on tour.
Absolutely, being stationary so long, sedentary, and hernias are part of the equation there.
Mm-hmm. But yeah, when it comes to neck pain and playing related pain, I guess is kind of more of what you're asking about. It could be as simple as sitting with good posture, which we've kind of been talking about posture for, I don't know, how long have we been doing this now?
Yeah,
for all of time.
It's extremely topical when it comes to drumming injuries, because drummers are the only musicians that always sit, if they're drum set players,
Right. Yeah. Right. I mean, you also have pianists and cellists too, but
Sure.
those, but
I mean, drummers. I'm sorry, but as far as opposed to marching and which, of course, they can get
I
neck
got you.
pain.
I got you.
Yeah, but when it comes to posture for drummers and
I mean,
sitting,
posture goes with sitting and standing, but I think for drummers, it's posture. It could be the setup. We've talked also about your ergonomics and kind of where you place the different components of your kit. But then the third thing that I probably would see or say that people should be thinking about is how they move. So posture, that kind of goes without saying. You don't want to be in that slouch position, because what that does is it ends up putting a little bit more pressure on the joints in the spine, which could cause pain and discomfort. If you have poor ergonomics, let's say that you have to reach a lot, for different your crash cymbals or whatnot. If you don't have good shoulder mobility, then a lot of times you have to hike your shoulder up in order to get to whatever you're trying to reach at.
right?
Or if you're crossed over, let's say that you're doing a lot of work on your hi-hat and you don't have good flexibility here, then that's going to translate over to the position of your neck. The other thing is just overall movement. And so a lot of drummers I see, they will bob their head when they're playing, right? Pretty much almost all drummers that I've seen will do that. And some
are headbanging.
Some people are headbanging, which is a real thing. Or if they're not moving from their neck, they're moving from their shoulders too.
Oh, good point. Yeah, I think I do
and
that.
They're doing something, right? And so
Especially
again,
if it's a really funky beat and you're just, it's like dancing.
Or you're doing something
yeah,
this.
the lunge. Yeah.
That's creating a lot of shear forces through your neck. Or if you're just nodding up and down, that's going back and forth, so that's putting compression on your spine. So again, it's not to say that those all are bad and that no one people shouldn't do those at all. It's just that you think about maybe picking strategic times where you are doing that thing, or if you do have to do that while you're playing, or that is how you move while you're playing, what are you doing when you're not playing to kind of like offset some of that? Are you doing stretches to, kind of decrease the tension that are going through those muscles there, or are you like stretching other components to allow you to be able to open up? So, there's a lot of ways that you can kind of go about thinking about it, but those are probably like the three things that I typically see, like drummers specifically, kind of from
Let's
either posture, it's their ergonomics, or just how they move in general.
Right. Let's look at the actual anatomy of that and look at where the injury is and what is being injured so that people can kinda
Yeah.
really, literally see it and understand. And folks, if you ever have anything like this, chime in the comments. Tell us where you're watching from. Tell us if you have neck pain from playing any instrument or even any of the other things that we've covered on the show that will continue to cover things like carpal tunnel, sciatica, lower back pain. We're going to cover more about lower back pain on the next episode next month. Carpal tunnel, arthritis, tendonitis, bursitis. There's so many
All the
different
itises.
all the itises, tonsillitis.
I can't talk about that.
Ironically.
Ha ha ha. All right. Do you I forget. Do you wanna
There we
yeah.
go.
Oh, there we go. All right. So, let's take a look. So the neck, let's take a look at the neck from the skeletal perspective just so we can start from there. So, as we talked about with posture in general, our spine has this like kind of natural S-shaped curve, and so that's normal. Our spine isn't actually straight up and down like in one line. You actually
Right.
have curves. But then as we zoom in, so what we notice here is that our necks kind of curve forward or backwards, I guess you could say. And that's to kind of offset the weight of the head because everything that we do is forward. And so that's to kind of rebalance everything. So it's like still in line with the rest of our body. But if we zoom in even more, so every segment of the spine here, so this is one segment here. Oops, let's skip this over. This is one segment here, and this is one segment here. And then this is basically this portion here. I don't know if you can see my arrow.
Yeah.
This is kind of where the joint is. So you have one joint on either side of the spine, one here and then one here. And that's kind of what moves when our spine moves. And let me see if I can get like a demonstration of what that looks like really quick.
Am I
Motion.
correct that a lot of those movements you described create inflammation in those areas amongst the tissue, whether it's muscle tissue or tendons or cartilage or
It it
what's exactly the
could.
injury?
Um it could cause usually it's more of like oh, that's not what I wanted. Let me see. It's usually more the muscle that
Oh,
gets inflamed. Let me just hide all of these, and hopefully you can see
yeah.
that when our necks move, one segment moves in relation to the next. So when
Right.
we tilt our head to the left, the top segment of our spine actually glides downwards, whereas
Mhm.
the right side kind of glides upwards. Same thing when we're rotating our head, they kind of have these equal and opposite movements, one
Right.
segment compared to the other. And then when we look down and up, they both move in the same direction, right? So that's what we talk about when we say the joints. And then we have a ton of muscles that attach onto the spine itself. So anything like close to the spine, so these are like the deep muscles here. A lot of times people will get headaches from these tiny, tiny muscles at the base of our skull. And this is a
Mhm.
common area where people kind of like massage out.
Yeah.
Just because what happens is that if we sit in bad posture, we tend to kind of jet our chins forward and our heads kind of go backwards. And so that results in these muscles here getting shorter, relatively speaking, and so they can get tight and sometimes like a little achy. So these muscles here are all like the really, really deep muscles, like closest to the spine, that helps give our spine stability. And then if we add in more, you can start to see all the other muscles that kind of also attach onto the spine too as we go layer by layer. And all of them attach on the spine. Even our trapezius muscles that we've spent a lot of time talking about,
Mhm.
um, our levator scapula muscle that also like it's hang on, let me see. It's this guy here, the levator scapula, also attaches on the spine, but on the sides of our spine. So we have a ton of muscles that kind of go on the
Yeah.
spine. And so when those muscles get overused, and those are the muscles that are largely responsible for our posture, right? And so when those muscles get tight or fatigued or anything like that, they can be usually they're the primary source of pain. The joint itself, like what I was showing earlier, can get inflamed too. Typically, where you'll see that is like I don't know if you've ever like slept funny and you woke up and then like you can't move your
Oh,
neck, like
yeah.
you just kind of have to move your whole body.
Yeah.
Um, and like if you try and turn your head, you're like you can only go so far. It just gets you really stiff all of a sudden.
Yeah.
Um, Usually that will follow a certain pattern. So, for example, you remember how I was showing you how like when you're rotating one
Like the
side goes up, one side goes down.
yeah.
So usually they follow certain patterns. So let's say that the joint on my right gets stuck, and I might have a problem where the joint has a problem with like opening up or kind of gliding upwards. So it'll be painful if I turn to the left or if I look down or if I tilt my head to the left
Mhm.
versus going the opposite directions might be okay, like might be less painful. Like that will fit a certain pattern. That would be more of like a joint
So
issue.
I have a question,
Yeah.
and it could I don't know if the answer is the same regardless which muscles are, let's say, call it injured, but the magic question, hot or ice or both alternating, and like, what is the truth on that? We hear so many things that heat will increase blood flow, which if it's swollen isn't good, and that ice or cold will
Yeah.
shrink. Like, what is the real deal on that?
That's a great question, and, kind of depending on who you ask and, where we are in the field of medicine, that's gonna change as well.
Really?
But my current kind of understanding or kind of thoughts behind it is if you have any kind of acute inflammation, and so that what that usually means where we talked about tennis elbow before, like where you have like something that's really inflamed. If you touch it with your hand, it feels hot to touch,
Mm,
or if you see like swelling in the area, um, generally we advise against heat while it's in its acute phase, because you're right, you don't want more blood flow to the area, which would cause more swelling, and that more swelling can cause more compression in that area, which
mm,
can kind of exacerbate the problem potentially.
mm,
Whereas cold, kind of the things that um, would be the bigger kind of contraindications to using cold would be like if you have a cold allergy, that's probably one of the main things. Like if you have a cold allergy, don't use cold to treat that area.
mhm.
Generally, ice or cold is probably the more safer option to go when in doubt. Like, and the reason why is because again, if you have some kind of acute inflammation, you don't want to make it more swollen or you don't want to drive more fluid to that area.
Mm,
Whereas cold doesn't really do that. Cold will cause the blood vessels to narrow or constrict, and so it actually reduces blood flow to that area, which will reduce swelling. The current debate, I guess, for a lack of a better term, in the debate against cold is that if like the question is like, okay, do you really want to reduce the amount of blood flow to that area if it's trying to heal? And
mhm.
so you'll find people kind of going back and like talking about it. It's not I don't think anyone has like a the magic answer yet. And the same goes to say with about like NSAIDs. Do you really want to decrease the amount of inflammation in that area if some of
Interesting.
those inflammatory agents are actually beneficial to healing? So I don't
Oh,
have the answer to that necessarily. However, both heat and ice are valuable as pain relieving tools because the the same nerves that interpret temperature, so if something is hot or cold, are the same nerves that tell our brains whether something is painful or not. And so
Interesting.
if you're putting on something that's, a little bit bigger, so you're applying an ice pack or a heat pack to it and kind of flooding the zone, your
Right?
brain's going to focus a little bit more on that sensation rather than the
The
tissue
actual
pain
injury.
itself.
Yeah.
So and there's a lot of value in that. That's called a gating mechanism of pain.
Mm.
The same thing as if you like whack your elbow on a corner and you're like, oh, that really hurts. You kind of like rub it. That's the same thing. You're kind of distracting your brain from, the actual painful
Oh,
stimulus.
it's a drawn to the sensation of what you're creating by rubbing it.
Exactly. So you're kind of overriding that like pain signal with
How
some
interesting.
other kind of like non-harmful signal. So both ice and heat have those properties where it can also override that pain signal. It's temporary, but if that is something that helps you kind of calm everything down and kind of allows you to do more things functionally, then that has a lot of value in that too. Um, if you're using heat is really good. So back to your original question, in cases of neck pain or even low back pain, most of the time, unless again you have active inflammation where it's hot to touch and there's swelling, most of
Mhm.
the time people can use heat as a way to treat neck or low back pain because it's a thicker area. There's more tissues involved, and because also those muscles are usually, like I said, the muscles are usually the ones that are kind of the problem or the source of the pain, anyways. And so the heat will cause the muscles to relax. It also might improve the pliability or elasticity of the muscle. So if you want to follow up with like stretching or whatnot, those tissues might be better primed to get more bang for your buck
Yeah.
after you do after you apply some heat to the area.
Interesting. I have a posture question for you, and since we're talking about the neck, we'll keep it in the context of that.
Yeah.
I know we're all like our anatomy's different, we're built differently, but I've seen people that have like a very forward, they're set like that. And I'm thinking, I think that had to have developed over time. And then I see people, I know a lot of people in the military, law enforcement, who just have what looks like great posture, like model posture. My question is, in combating some of this from a posture standpoint, is it possible to overcorrect
Yes.
posture? And is it to be too
Yeah.
straight, too rigid? Can you talk about that and what
Yeah.
that susceptibility it creates?
Yeah. I mean, being too upright and rigid is also bad posture. It's just that less people are in that position.
Mm,
And the way that I would look at it, and like you can do this within your own, like you can do your own experiment, is like, try and sit like really slouched, and then like
mhm.
take a deep breath and see how that feels. Okay, now sit in like what you think is like good posture. So imagine like a string kind of pulling you up, like you're directly stacked on your sit bones, and take a deep breath.
Okay.
And how does that differ or not compared to when you're slouching,
Okay. Yeah.
right? And then go super like back,
Yeah.
upper, like very rigid, like shoulder blades pinned back. Now take a deep
Oh,
breath again.
it's about as restrictive as the deep slouch.
Yeah.
I
Isn't
guess
is
'cause
is, is
it's
that
doing
surprising
something
to
to the
you?
it does. It must be doing something to the diaphragm, I'm guessing?
It absolutely can do something to the diaphragm, but then if you look at, um, the spine itself, remember we have a little bit of a curve, especially, like, here in the spine,
Right.
right? And this is in neutral, so this person is in, like, the most neutral position you can imagine.
Mhm.
So when we breathe, we get more air into our lungs, and what also happens is our rib cage expands, right?
Oh,
But
I see what's
our
happening.
rib cage is attached to our spine
Yeah. So
here.
you're restricting the billows in a sense with 2
Yeah, and
with
so if you are completely back and, like,
yeah.
upright and shoulders pinned back, you've basically taken up movement or
Yeah.
motion in the spine, so the ribs really don't have anywhere to expand into.
Mhm.
Um, versus like if you're slouching, the ribs actually go kind of collapse downwards, and same thing, you actually take away space for the lungs to expand into.
Wow.
Also like the diaphragm too, which you mentioned, lives. Let me just see if I can put in the diaphragm so you can see what that looks like.
And while you're getting there, this is super key for drummers who have a very athletic job as far as instruments go, and breathing is huge, but also, of course, for wind instruments, whether it's
Yeah,
trombone,
yeah.
clarinet, it's gotta be so key for them so they can
It's
maximize.
super key. Yeah,
Yeah. Wow.
100%. So this is actually the diaphragm. So the diaphragm is this like kind of like dome shape or umbrella shaped
Mhm.
muscle. And so when let's see, oh, it doesn't have the motion shit. So when you breathe in, this actually flattens out. It kind of pushes down, so it actually opens up more space in our trunk cavity
For the lungs to fill up.
for the lungs to fill out. And then when we breathe out, it kind of returns back to this position again. So when you change the position of your ribs, it actually changes the line of movement or the direction of force of where the diaphragm travels, and so then it can affect, how much air gets drawn in
Very interesting.
to the area. Yeah, yeah, super super interesting stuff.
Yeah.
Um, and there's actually a lot of talk now. This is a little off topic, but people who have GERD or who kind of like have acid reflux, there's a lot more discussion now about doing diaphragmatic breathing or diaphragmatic training because of this hole here. This is actually where our stomach or esophagus comes
Goes
down.
through. Uh-huh.
And so they're saying that like strengthening the diaphragm can increase the strength of the sphincter here to kind of prevent that reflux from coming back up the
Oh, wow.
esophagus. Yeah. When I heard that, I was taking a class. When I heard that, my brain just like literally melted like in that split second.
Wow. It makes sense because it's in a way, if you strengthen it, it's like grasping it, right?
Yeah, yeah. I
It's
mean, it's just gonna like
yeah.
yeah, super cool
Huh.
stuff.
It is.
Anyways, that's a bonus.
So for thanks. Let's go to the neck again and for
Yeah.
other instruments. Um,
Mhm.
before we get to the violin, and because there's all sorts of musicians and music fans that watch what we're doing, and the violin's obvious, there's something going on there that we'll get to. But what about people that have a guitar or a bass strapped on?
Yeah.
It if the strap is too skinny, I'm thinking
Yes.
that could cause injury. If it's too heavy,
Totally.
does it matter
Totally.
where they're wearing it depending on
Mhm.
their torso and, their whole anatomy? Like, talk about that a little bit because I gotta think that's gotta come into play at
It
some
is
point for
100% gonna come into play. Man, do you wanna do this show? Like, I feel like I could just sit back and you could talk about this stuff.
for me,
Or
there's just
maybe
sort
maybe you've been, like, hanging around me too much. Uh,
of I want the
um,
certificate. Where's to go with my
yeah,
film awards? Where
my $5 diploma in my back pocket. Um,
still smells like Cracker Jack caramel.
uh, yeah, so if we're thinking about a guitar, usually the strap, regardless if you play right-handed or left-handed, but let's just say that you're a right-handed guitarist,
Yeah.
is gonna sit on the shoulder, kinda like the fleshy part of your neck here. So
Yeah.
usually that's gonna mean like the upper trap is kind of like the muscle or the soft tissues that's gonna have the most compression, right? And so
Yeah.
what that muscle does, so the upper trap as well as I talked about this briefly before, the levator scapula, these muscles in particular, those 2, they what they do is they both raise the shoulder up without any weight on it, like, that's what their job is to raise it up. And so when musicians, guitarists, even violinists have a weight pushing down on the shoulder, the body's naturally gonna want to counteract that and resist it so the shoulder doesn't keep getting
Mhm.
pushed down. Right? And so there's always gonna be a little bit of activation in those 2 muscles specifically, if not other ones. I mean, other ones for sure, but, like, those 2 specifically.
Interesting.
Um, and not to say that that's bad, like, that's kind of just how it's gonna be because you
Yeah.
have a weight sitting on it, right? And
Mhm.
so, but if you have a really skinny strap, then that's gonna make the pressure that is being placed on those muscles a lot more specific or much more focal.
Right.
Um, and so that's going to concentrate all that force in a very small area. Whereas if you have a thicker strap, you can kind of spread the force out over the width of that strap. And so I usually will recommend to people to have a thicker strap if they can help it, or have something that has a little bit of a bounce. So like something where like they have like a neoprene area on
Yeah.
top or kind of like a pad where there's some kind of recoil to take up some of that shock. Because when people play, especially if they're playing standing up, obviously they're probably going to be moving. And so any kind of movement in that can be absorbed through the strap a little bit more so than like the muscles having to accommodate or adjust
Right.
to that is usually what I recommend to people.
It's interesting because
Yeah.
I have stringed instruments. It's not my first instrument, of course, drums
Sure,
are,
sure,
but
sure.
I've experienced wearing a guitar, wearing a bass and everything, but I'll tell you for how long this has been bugging me. And if I ever meet Jimmy Page, this is gonna be one of the questions I ask him. Ever since I was a teenager when The Song Remains the Same came out, and he's playing a Les Paul with a black leather strap that's like half the
Ouch.
width of a
Yep.
normal belt you would wear with jeans, and a Les Paul is not a light
No,
guitar.
those are heavy instruments, yeah.
Yeah, that always bugged me, like, it just looks so uncomfortable, but who the F word is gonna question Jimmy Page about what kind of strap you're using, you know? But it's always looked so painful and his dexterity moving, dancing around while he's playing. How does that not and 81, 82 years old now, you look at him and it doesn't look like he has any sort of deformity from years and years of that. He's worn other straps with other guitars, of course, but that always bugged me. And now I understand what's going on there, the compensation your body is trying to do. And you mentioned straps with pads, and there's so many players of bass and guitar that we've all seen that have that extra sort of wide portion that
Yep.
has like a sheepskin
Yep.
lining underneath or faux sheepskin
Yep.
for those of you that might get mad, and I can see how that makes such a difference.
Yeah.
But that always bugged me to see him playing like that with this. It's
Yeah.
like you
I
might
mean,
as well
to
just
each
use a
their
guitar
own.
cord for a strap, you know?
Yeah. I mean, that's the thing is like to each their own. And if it works for them, great. But it doesn't mean that it will work for
It
everyone.
seems to have worked out okay for him.
I think so. I think he's doing all right.
But and then, I mentioned with a violin player, I don't think I know that I've seen, especially electric violin players that have like a device where their
Those
violin's
are
basically
really cool.
strapped
Yeah.
on, yeah, but there still seems to be a bit of this element to even those. So
But
whether it's someone sitting
yeah.
that's playing orchestral or symphonic and they're really gripping it, there's always that element. Do you see a lot of people that play viola or violin that have that ailment?
Oh yeah. I mean, that's so violin is one of my main or is my second instrument and I
Really?
see yeah, I see a lot of violin. It's actually like one of the big areas that I've like really gotten into since I've been a PT is helping violinists and violists get a good setup on their instrument. And so in the world of like upper strings players, whether we're talking about violinists, violists, some people don't play with a shoulder rest. Like that's like a pedagogical thing where they just don't play with one. And so they have to like support their instrument with their
Right.
arm. And then most violinists and violists I know these days will have some kind of setup with a shoulder rest.
Yeah.
Um, but they shouldn't in an ideal setup, if I had my way, they shouldn't be tilting their head too much. A little bit is okay, like, just because you have to. Like, you have to be able to hold the instrument between your jaw and your collarbone, but it shouldn't be so much where you're, like, at a 45-degree angle or something like that.
Yeah.
A little bit is fine. Like, you're really not gonna, break your neck if you have a little bit of an angle. Um, but it depends and also having something that was too high where it's, like, pushing you, the other way, that's also bad too. It's just finding that Goldilocks, balance, right?
Right.
But same thing, like, if you have if you play the violin or viola, you're going to be using the upper trap. You are going to be using the levator scapula, and because that's the way that you hold the instrument. And so it's like, okay, well, what else are you doing outside of playing to offset the amount of work that those muscles are doing? And are you optimizing how it's working when you are using it? So that's kind of like the discussion that I have because
Interesting.
can't
And then one more
yeah.
instrument that
Mhm.
does require a strap along with the weight of it, going all the way from soprano sax to baritone
Yeah.
sax. That strap comes around the back of the neck. Do you see a lot of people that have issues with that? And
Yeah.
should they be compensating by pulling back, but not too much because of that overcompensation we talked about? What's the equation there?
The equation there, so I don't like the lanyard style straps, and
Okay.
I try and advise people to move away from that. If
What else is there? I'm not
there's
familiar with.
ones that are kind of, it looks like a reverse backpack basically, and so they
Oh,
wear like they like it clips in the front, and so the weight is more distributed through like the backs of their shoulders rather than going straight through the back of the
oh,
neck. So usually I'll recommend something like that. There are other harnesses um, that I've seen in where it's like almost like a stand, like a kickstand.
oh, interesting.
For yeah, so I mean that's why I go to like the NAM show, for example, is I don't go to look at new, like I go look at what ergonomic gear is coming out, so that I know maybe like what I could potentially advise people
Yeah.
to look
It
at. But
I mean,
yeah,
it
I
says a
yeah.
lot that that's even a thing, that's
Mhm.
even enough of it to be at the NAMM show says a lot that you've gotta pay attention and not just do something because people have been doing it with that instrument for the last 100
Right.
years or whatever, whether it's drums, sax, violin, or whatever.
Right. Yeah, I mean, I would say that mm, most distributors aren't doing that in mind, but there's always like a couple booths that like actually think about those things, and
Yeah.
they come up with innovative things for better or for worse. Like some of them I see, I'm like, I'm not quite sure about it, but I get what you're going for, kind of thing.
Yeah.
So it's always an exploration and kind of a learning process for all people involved. And I don't play all instruments, so maybe there's something with a saxophone that someone would develop a harness for that I would not have thought of because that's just not the instrument that I play, right?
Right.
So
Right.
um,
Cool. Janice, how can people get a hold of you? I'm pretty sure we have the information in the description of the post, but and I'll take the program down.
oh yeah.
Um, do you only see people in person or do you do stuff via Zoom so that someone long distance, if they're having an issue as a drummer or any musician,
Yeah,
can they
I mean,
reach out to you and still do consultations?
yeah, I absolutely see people for like consultations, especially for like ergonomic setup stuff. It depends on if you need physical therapy. I'm licensed in California, Washington, Missouri, and Florida. Kind of random,
Wow.
but so if you had some kind of like physical pain that you needed to work through, like I can see people in those states. But if you need like, I do a lot of like instrument setup consultations, and so people send me videos and we kind of go through it together. You don't need like I don't need to be licensed in those states to
Right.
comment on those things, and so I see people all over the world for those kind of.
That's great. And where's your physical office? You're downtown LA, right?
Yeah, my physical office is in downtown LA, close to Staples Center, if you
Oh,
know
okay.
what. Yeah, or crypto.com, whatever you wanna call it these days.
Yeah, I can't keep track of all the stadium
I will
names.
always call it Staples Center until the
Yeah.
end of time.
It's like to me,
But
the one in Chula Vista will always be Coors Amphitheater.
there you go.
The LA Forum it went from
Always be the
LA Forum,
forum.
the
Yeah,
Great Western Forum to I don't even know what it is now. I was born
it'll
down the
always
street
be the
from there.
forum. Yeah,
Yeah.
exactly. Yeah, but people can reach out to me. Usually, like Instagram is how most people find me. So it's like at opus_pt, or you can find me on the internet at opuspt.com.
Great, and we're back next month on Friday the 18th, same time, 1:30 Pacific, 4:30 Eastern US time, 9:30 UK on a Friday night, if you're not doing anything or just wanna learn more about this, and we're gonna cover lower back pain. Again, a musical instrument injury or affliction that's not unique to just drummers. So we'll probably dig into posture again and some other things. And maybe some of you could chime in on that with me for the backrest or no backrest on the
Ooh.
drum throne issue, because I've got questions for those of you who use that. So keep lock and load that one for next month on
Yeah.
July 18th. And happy summer, everybody. Thanks for following what we do. Thanks for joining PT Janice Ying and myself, Dan Shinder, here on Drumming Injury Talk on Drum Talk TV. We're still calling it. Yeah. For now. Wait, what? Yeah, there's more music coming on that. More music, more information. You'll see. All right, folks. Thanks. We'll see you soon. Thanks, everyone.